Yes. Good morning.
Good morning, sir. How are you? Good morning, doctor.
This is good morning. Good morning. This
Bala.
I in one A. Who is this?
Hello, good morning,
Maybe myself. Maybe me.
Maybe myself. Yeah.
Maybe it's me. Yeah.
Okay. I was in another session. That is for the
Yeah.
MBA session. There was a query, clarification at the end of the session, like a feedback review.
Okay.
So it took some more time. I think uh, today's presentation is all about Army's presentation, but his background has changed and everything has changed. So very, very, very good morning to all of you. Very good morning to all of you. And Bala is joining once again, I think. This is Shashik. In one is Bala, right?
No, I don't know who is that
Yes.
in one.
But Bala,
Yeah. Yeah.
Bala is also
It's
joining.
me.
Yeah, but Bala is joining again through another name.
How many
Usually,
devices do you have,
Yeah.
Dr. Bala?
I joined from my mobile as well as
from your
my
desktop, yeah?
computer
Okay.
because mail is working, so I'm just came to another room.
Okay, no problem. We are just waiting for others to join. I think Ruben will not be joining today. He has some inconvenience caused. Before starting the Army presentation, I have some questions to others. The question is, how your, already Pillai and Ruben, then Bala, Shashikumar presented your topic in the previous research seminars. So how well your progress right now? Are you waiting for the next seminar presentation, or meanwhile, are you doing something yourself? Any progress? Like, are you at least you're thinking on your topic? Like any restructuring your topic or something you're adding into are you ready for the next presentation, or preparing or adding new materials into your data folder? So any progress comes from your side, please.
Yes, doctor. Being first, I have to start first. So I am collecting the relevant information from various forums. Now, in my LinkedIn, I am getting a lot of information regarding the hydrogen fuel cell for the future vehicles. Storage of hydrogen was the issue before, like how we face the problem of storage of energy in the battery. So a lot of technology is now evolving for the storing hydrogen, and as well as for the fleets also. The 10% of the total footprint, carbon footprint, is from transportation. Out of 10%, 4% from.
Like, we're not able to hear properly. I don't know why.
Am I audible now?
Yeah, you are audible right now. Yeah.
So 10% of the fuel is from transportation. Out of this 10%, 4% is from fleets, from the sea transportation. So I'm collecting the relevant data for the future energy transition, how it is going to be in the future. And recently, you might have seen yesterday, India has launched atomic power based submarine.
Yeah. Yes.
So a lot of changes are going on worldwide for the energy transition. So I'm collecting the data. So soon I will be completing my objectives and the verifications also.
Perfect. So you are also meanwhile collecting the various informations for your literatures and to finalize your topic further. Perfect. So Bala is also doing the same, I expect.
Yes, doctor.
Okay.
Data collection, and I'm just downloading some
Mhm.
books as well as some uh, lectures about the articles about water management. So the data collection is on.
Very good. So I understand you're having the realization like that this is, we are going to, that area, this is writing. The first part is almost, the research seminar presentation itself. Second part is we are completely start writing something. Then we will feel, we are doing something particularly. Now itself, you felt it something, the first year is completely for your coursework, and second year is going for some research seminar presentation. Now you maybe start feeling like we are doing something related to our topic, my specialization. So it must be strengthened, and there must be some intensified effort from your side. That's all about. I know that you're doing very well. Anyway, just only for reminder, that's all about. So Ami, yes, Ami, welcome. Yes, you're ready with your topic. Yes, please share your viewpoint. Share your viewpoint. You can start sharing. Okay, I'm coming with my hot water. You
Yes,
can you can
doctor.
you can you can share with. I'm here itself.
Has everybody already seen my background, my presentations?
Yes, yes.
Okay. Thank you very much, Dr. Bala. Good morning, fellow doctors. Right now, my topic, one of my chosen topic, right, I'm gonna present is regarding optimizing ambulance delivery through strategic healthcare system integrations and collaborative efforts. So for agenda for today, we have the introduction, objectives of the study, statement of the problem, research gap, significance of the study, and review and related literature. First, I'd like to start with the quote from Tolstoy: "The sole meaning of life is to serve humanity," as being, humble and uh, servant in our community. So, first of all, it
So
starts with the introduction. Go on, doctor.
yeah. Sorry for the interruption. Can you just go for your topic first once again? Optimizing the ambulance delivery and the transportation.
Through
Yes, through
yeah,
strategic healthcare system integration. Yeah,
integrations
through
and
strategic
collaborative
healthcare
efforts.
system integration. Perfect. Okay, continue, please.
First of all, I'd like to give you an overview regarding the ambulance services in UAE. Currently, uh, in UAE, there's a divisions of, each different emirates have different kind of ambulance services. Like for the Abu Dhabi, we have the Abu Dhabi Civil Defense under the Emergency Public Safety Sector. Then for the Dubai, we have the Dubai Corporations for Ambulance Services. And for the rest of the northern Emirates, from Sharjah going to Fujairah, they are being under the National Ambulance or the National Guard ambulance services. And the others are ambulance service provider, mostly in Abu Dhabi. They are the third party allocating for other critical infrastructures of the government and other hospital services. So for these things, I'd like to share some of the data coming from the National Ambulance from their website. They have 50 ambulances, 50 ambulance points in Northern Emirates, and they started their services in 2014, and they have 14 bases, 110 emergency ambulances, one helicopter services. They are the air wing of the Ministry of Interior and almost 600 employees. Right now, as of July 2024, they cater almost about 1,200,000 plus number of received calls and 575,000 number of treated patients, then 356,000 number of transported patients since the beginning in 2014. Okay. Likewise, I'd like also to boast to you the Dubai Corporations for Ambulance Services, as these are the special services that they cater: people of determinations transfer unit, the intensive care unit, and the maternity care unit. I was trying to emphasize on these things because later in the part of the review and literature, and the introductory part, you can see that there is on the statement of problems, there is the variance of the ambulance services to be catered in UAE. So right now, the timely and efficient delivery of ambulance services plays critical role in healthcare system as it directly impacts patient survival rates and health outcomes in emergencies. However, due to the increasing complexity of healthcare system, as well as rising demand for emergency medical services or EMS, optimizing ambulance services has become ongoing challenge. This issue is especially pronounced in rapidly developing regions such as the UAE, where the healthcare infrastructure is advancing quickly, but often struggles to keep pace with the demands of EMS. As you can see, Dubai is trying to be one of the tourist hub, wherein in fact that they're catering more on tourism. Therefore, the more complexity in terms of the diversity of the people, expatriates coming in terms of it's not only on the tourism, but they're trying to make it as in the medical hub in UAE as being, it easily goes to, you can go to the Europe or go to the America as West being in the middle of that kind of thing. So strategically, geographically, UAE is one of that being as considered as a hub. And Dubai, you have a lots of, you have the London College of Hospitals. In Abu Dhabi, you have the Cleveland Clinic as one of the, I might say, point of references in terms of their specialty kind of hospitals here in UAE and in the Middle East as well. Existing research on ambulances optimization has traditionally focused on isolated metrics, including response times, resource allocations, and patient outcomes. While these studies offer valuable insights into the critical elements of EMS, they do not fully address the interconnected nature of healthcare system and how strategic integrations and collaborations among providers could improve overall EMS efficiency. For instance, highlights that while response times is a significant factor, addressing it in isolation may lead to other inefficiencies such as strained resources or unconditional care continuity. As I may have said, likewise in Abu Dhabi has been divided into three. We have the Al Dhafra region or the Western regions. We have the Al Ain and the main Abu Dhabi. They are being all catered by the Abu Dhabi Civil Defense, the Emergency Public Safety, meaning to say they are the one have the authority by the Department of Health to cater to provide services for the public. Okay. As I may say, that the EMS or the Emergency Public Safety or the Emergency Medical Services under the ambulance services, they are being catered by the Abu Dhabi Civil Defense in terms of the medical and trauma emergencies. So other than that, if there's anything pertaining to hazmat or the CBRN or the chemical biological, there is the other different kind of services that will respond to this matter. Okay. So we have the first line of defense of the Abu Dhabi Civil Defense that caters, the normal call for the 998 call. So they are the ones responding to the public. Okay. In terms of big accident or incident, there's a different kind of, mobility or response that the government of UAE is providing, especially for the critical infrastructures like the SICPA bases. They are being under and manned by the National Guard. So National Guard have their own kind of ambulance services that handle this kind of quality, this kind of incident or scenarios. The research gap particularly evident in regions like the UAE, where the healthcare sector is expanding rapidly, but faces unique logistical, demographic, and policy-related challenges. A key issue is the limited number of studies examining how collaborative approaches and system-wide integrations impact EMS in these regions. Studies suggest that integrated EMS frameworks can improve response times and patient outcomes, but there is a limited evidence on how such frameworks could be effectively implemented in developing regions with different regulatory infrastructural characteristics. Emphasizes that the challenges of integration often stem from fragmented healthcare policies and insufficient collaborations between EMS and hospital systems, which can result in a duplicated effort or gaps in service delivery. This one happens during the pandemic times because Abu Dhabi is being catered by the Department of Health, while the Sharjah or the Northern Emirates, they are being under the Ministry of Health. So there are two kind of, regulatory different kind of regulatories phases because the Ministry of Health, different one. So in terms during the time and pandemic, patients, they have allocated traveling, going and out of Abu Dhabi. It become duplications. So what we are being catered in Sharjah or in Ajman, sometimes they are already in Abu Dhabi. So it becomes quite complicated more when there's a lot of patient care record being handled. So there's no uniqueness of their numbers to the point that the data is being duplicated and being increased because of same patient but multiple number of patient care record numbers. So additionally, there's a lack of research on the practical barriers to implementing integrated EMS solutions in UAE. Existing studies primarily focus on developed countries, while healthcare and EMS integrations is more advanced. Many developing regions lack the data infrastructures and interagency communications channels required to coordinate EMS efforts effectively. This research gap leaves questions about how to adapt successful strategies from developed contexts to regions like the UAE, where factors such as population's growth, urbanizations, and diverse patient demographics presents unique challenges. Another underexplored area in current EMS literature is the role of advanced data analytics and technology in optimizing ambulance delivery. While several studies suggest that real-time data and predictive analytics could transform EMS efficiently, most research remains theoretical with limited implementations in real-world context. There is an evident need for applied research that examines the practicalities, potential barriers, and cost-effectiveness of using advanced technologies in EMS, especially in rapid evolving healthcare landscape such as the UAE. In light of these gaps, this study aims to develop a comprehensive framework for optimizing ambulance delivery through the strategic healthcare system integrations and collaborations by focusing on the UAE. The study seeks to provide actionable recommendations tailored to the unique demands of this region's healthcare system. This research aims to bridge existing gaps by not only exploring isolated EMS components but also proposing an integrated approach that consider regional challenges, collaborative practices, and the application of data-driven technologies to improve EMS efficiency and patient outcomes. So the objective of the study, to explore ways in which ambulance system can be optimized through strategic healthcare system integration and collaborative efforts to improve patient outcomes and system efficiency, to identify the primary challenges and limitations of current ambulance delivery system and assess their impact on patient outcomes and system efficiency, to examine how healthcare system can be integrated to optimize ambulance delivery and identify key factors influencing successful collaborations between different healthcare providers. To identify the most effective optimization strategies for ambulance delivery and to explore how these can be implemented to improve response time, resources allocations, and patient outcomes. I'd like only to emphasize one of the gold standard providing ambulance services in UAE is the National Ambulance. We have a response time of less than 10 minutes to respond on the scene, and we have a maximum of 15 minutes to manage or stabilize the patients and need to immediately brought to the nearest hospital or to the category of hospital that the patient should be needed. So with this, we have the data, as most especially as this is part of our KPIs to put on the standard level. So I might say people in the Sharjah going to Fujairah, once they have been reached or called for the 998 or ambulance services, rest assured that the response times and allocated time for the one to reach on your area will be in less than 10 minutes, plus 15 minutes, that including your assessment and starting their management. Then you can now go to the hospital for further management or treatment as per it is. So that is the gold standard, what we are implying or practicing in the Northern Emirates. For the Abu Dhabi regions, they're trying to make the same kind of situations to the point that there's a lot of barriers or factors that influence pertaining in response times in Abu Dhabi. I don't have the concrete data right now, but as from the previous years, as I was with the Abu Dhabi Civil Defense, that is the almost, we have 10 to 15, that is the range, maximum of 20, and sometimes stay more than 30 minutes on the scene just only to manage the patients due to some issues, factors, including equipments, accessibility to the locations, likewise, the kind of ambulance that we're providing in Abu Dhabi. So other objective study is to investigate how advanced data analytics and technology can be leveraged to improve ambulance delivery and to evaluate the potential benefits and challenges associated with their implementations. Last is to identify policy and regulatory barriers to implementing optimization strategies in ambulance delivery and to propose recommendations for addressing these barriers to facilitate changes. For the statement of their problems, it's always been the same, that what is the demographic profile of response in terms of age, gender, and educational attainment. Later, and the review and related literature, I will explain further why it's the age and gender and the educational attainment is need in terms of the respondents to how can ambulance delivery systems be optimized through strategic healthcare system integrations and collaborative efforts to improve patient outcomes and system efficiency. So what are the primary challenges and limitations of current ambulance delivery system? And how do these impact patient outcomes and system efficiency? How can healthcare systems be integrated to optimize ambulance delivery, and what are the key factors influencing successful collaborations between different healthcare providers? Fifth, what are the most effective optimization strategies for ambulance delivery, and how can this be implemented to improve response times, resource allocations, and patient outcomes? Six, how can advanced data analytics and technology be leveraged to improve ambulance delivery, and what are the potential benefits and challenges associated with their implementations? Seven, what are the recommendations, policy, and regulatory barriers to implementing optimization strategies in ambulance delivery, and how can this be addressed to facilitate change? For the research gap, research on optimizing ambulance delivery has traditionally focused on isolated elements, such as response times, resource allocations, and patient outcomes. While these studies provide essential insights, they often overlook the holistic impact of healthcare system,
Oh my God.
integration, and interagency collaborations, particularly in rapidly developing regions like the UAE, where EMS faces unique demands from a growing and diverse populations.
Are you able to hear me?
Yes,
Okay, okay. I was talking just before, but it's not working. I don't know exactly what happened. Okay, okay.
go
Are you
ahead,
able to
Doc.
hear right now? Yeah, yes, yes.
Yes, yes, Doctor.
Okay. I have one question to you. The
Go
question
ahead,
is,
Doctor.
you have given your topic is optimizing ambulance delivery through strategic healthcare integration system, collaborative efforts.
Yeah.
Yeah, that's the topic. So you wanted to do in UAE itself.
Yes, that's the
Yeah,
local
okay.
or the
Okay. You
target
have
of
you,
the.
you have mentioned something its relevance. Like the response time is almost 10 to 50 minutes maximum. And why then what is the importance of your topic then? See, now whenever someone is calling for an ambulance services, obviously we believe we have a trust that it will reach within very short span of time, we will be getting the best services. So how and what you are going to do with your topic, and what is, already you are in the research gap right now. We have some question over there. So why do you believe optimizing ambulance delivery through healthcare integration is a critical issue in today's healthcare system? That's my question.
The optimizing ambulance delivery through strategic healthcare system and their integration is that because of there's a different kind of, although provider for this kind of ambulance services. First, they have different kind of their training. There's no such thing as a gold standard of training
Mhm.
in terms of the providing regulatory from the Department of Health, which being provided by the Abu Dhabi, and from the Northern Emirates, they are being given by the Ministry of Health. And in the Dubai, they have been delivered, or they have different kind of requirements from the Dubai Health Authority. So meaning to say, if the provider or the emergency medical technicians in the Northern Emirates, they have a most highest kind of level of training, or kind of, I might say, their professionalism in terms with the people in the Dubai, in the Abu Dhabi or in Dubai, to the point that their training and their licensing, they are at par. So their scope of practice have much greater. It's just like an equivalent level into the a paramedic level in US, and advanced level in UK or in London, where in fact those kind of level of training in Abu Dhabi and in Dubai, they are on, I might not say it's in the gold standard, but they are under below on this kind of level because of their scope of practices are not being met at the same time. So there's a different kind of scope of practices and equipment being used in Abu Dhabi, and same as the different scope of practice and equipment being used in Northern Emirates. The integrations of healthcare system have different also, because in Abu Dhabi, most of the response of the ambulances, they cater mostly, they have to bring it to the government facilities. You have the Sheikh Khalifa in the city. They have Al Raba, but Al Raba have only cater on the trauma and some of special case of the burn units.
Mhm.
So it's not, it's not different thing that they can always bring in a one particular tier tier three hospitals that provide a one-stop shop. Unlike in Northern Emirates, especially in Sharjah, you can always bring into uh, uh, the hospitals. Uh, I forget the one big hospitals in Sharjah that catering mostly of all the cases that we bring. We have the Kuwaiti is a private hospitals, but they cater everything. But the thing is that one, their approach in terms of people accepting through ambulance patients is just like they're waiting a lot of times in the waiting area. So not everything is being catered immediately. Unlike in Abu Dhabi, once they bring the patients through ambulance and bring it to the accident or emergency area, they immediately attended to. Okay, so but there's a variance in terms of approach on how they uh, face or act or accept the patients for these things. I acknowledge you later, Dr. Pillay. So in Dubai, same cases. Okay, they cannot bring patient according to their choices, but they can only bring the patients according to their area of responsibilities. Meaning to say, if the patient is in Hamim or in Hamim area or nearby the Hamim area, the patient, the ambulance there can assess and address the patients, but they cannot bring the patients to the city like Sheikh Sakbut or in the Abu Dhabi main city. They have to bring the patients in Liwa. Same with the cases in the Madinat Sayed and Western regions. So they cannot go across according to their area of responsibility. So other things that one of the optimizing ambulance delivery and the integration and the strategic is their equipments. Okay, so there is no interoperability in terms of equipment being used. Like on our side, our equipment being used, we have the standard kind of equipments in each every ambulances that we are providing to the people in Northern Emirates, that we suggest that each of the receiving facilities, hospitals, they have also, same equipment that we're using so that there will be a lesson time of uh, and addressing immediately the needs of the patient, like the monitoring device that we're using. We're using a LifePack 15, where the other hospitals, they are not using the same equipment that we're using. So there is a delay once we transfer or endorse the patient. There is a gap of almost 10 to 15 minutes just to transfer the patient's monitoring device to the point that they have to use because their device is not the same as our we're using. So if you can see the delay of the patient's outcome in terms of management, so that is the one thing that need to, I think, to address pertaining to those things matter and so on and so forth. These studies still have to I can say more to expand more in terms of these things so
So,
that
Ami, where do you work right now? North Dubai.
I'm working in Abu Dhabi, doctor, in the Civil Defense Academy. Civil Defense Academy is the facility, and they hired us as a third party to provide services for them.
Okay. Good. Fine. You can continue with the research, Kat.
Uh, Dr. Pillay, can I have your questions, please?
Yeah. Thanks for allowing me. You mentioned about the response time, 10 minutes is already met.
Yeah.
I'm wondering the region, Al Ain and Abu Dhabi, it's fine because it is a city. What about Al Dhafra region, is being industrial area? How this 10 minutes KPI time is met, because it's within the industrial
That
area as well
is,
as the domestic people are there, like Liva and other area. How it is met, any tie
yes.
up with the industries is made? The first question. And the second question is, Normally, this emergency calls will be handled by toll-free numbers, 998. So some people will be managing these calls. Are they provided any software to identify which area is nearby, which is ambulance is free, so that they can ask them to send it through system-based, or it is manual-based, it is being manual? These are the questions. Thank you.
Okay, thank you very much, Dr. Pillay, for your questions. So in terms with the response times, in Al Dhafra area or the western regions, they're being giving a maximum of almost 20 minutes for that. When I was in Hami, in Ruwais, Gayate, and Hamim region, and even in Greenalish, our allocated time to response is 20 minutes. Okay, that start from the activating the ambulances. Okay, because as pertaining to your second questions, there is the ambulance communication center, or we call it as their operation center. For the Abu Dhabi, there are four located ambulance centers, one in the main Abu Dhabi city, one in Al Dhafra, one Al Ain, and I think two in Al Dhafra, one in uh, Grenadish or before the Banidat Sayed, and the other one is between Ruwais and the Baraka. So in terms with that one, they are the one who call or receive the calls from the call takers, and from there on, they assess what kind of emergencies they are. Okay. So when you call for the 998, immediately your phone will be locked. Okay. Your phone will be locked. Your locations will be activated immediately. And the only thing that you can call in for that thing is the 901 or 998 people or 999 persons until such time that everything will be resolved in your end. So meaning to say, uh, you can call other persons, but it will be limited to 998 or 999 once you have called 999 or 998 for such matter. Because they want immediately your line to be cleared from any kind of interference. That's why they immediately lock your phone for locations and address what is kind of emergency you are dealing with. So those are the applications we're using. Same with the applications being used in Northern Emirates. The National Ambulance have applications for the 998, meaning to say, same kind of approach, but these applications, when you activated the ambulances immediately, it will lock in immediately your locations, and the call takers or the ambulance communication center will immediately address your concerns, and from there on they will assess what particular kind of emergency, or maybe just only need, you know, they're trying to we call it sanitize that kind of calls, because some are being it's only just a prank calls, or some are just only, toothache and they need an ambulance service. That's a
Understood.
waste
So
of
that means,
resources.
yeah, that means it is being handled manually, and the ambulance are being allocated based on the availability of the nearby sources. Isn't it?
Yes, the call takers is a human persons. It will be handled manually for that one. But once the ambulance been activated, we are using applications for this kind of thing. We have a small laptop in our unit that is being used, or we call it the MDTs. That is the time when being activated. We have the PDT being used for us. Once we're being activated, they will send the GPS location of the patient. Then immediately the time is running clock. It is a gold time for ours, because we have gold time in our response, especially if it's trauma or road traffic accidents, because that is the one
Yeah.
thing that
Unfortunately,
we're trying.
unfortunately, we are the poor guys. We use this phone. This phone does not have GPS and
Oh, I'm sorry for that
if
kind of
anything
thing.
happens,
Yeah.
yeah, yeah. You cannot share our
you
location
have
also. It's location.
you have
GPS
to
is disabled.
yeah, I do understand, especially in the oil refinery or in the critical infrastructure facility. Actually, that is the one thing that we're facing right now with our colleagues, because due to the strict of equipment, there's no camera. Phone cameras are not allowed. Okay, that is during the time in 2014-15, the BlackBerry phone is being banned in that kind of facility, especially in terms of their messaging app. Okay, and the
So it will be
activations of
helpful to us through your research. You can recommend even GPS to be enabled for us, so that at least we will get relieved from your side, through your
So
side.
I
Pillai,
will
so Pillai was
I
trying
will
to
put that one.
make exploiting this advantage. Yeah, I mean this topic.
Yeah. Seriously, see, I just now I'm trying to book an airport taxi, which I'm traveling next week. I'm traveling. So I'm not this app. I have my phone, this one, my SIM card, and app is there. Abu Dhabi taxi app is there, but they are asking for location, so I'm not able
Okay.
to use it. So it's useless. This phone is useless, even though it's a smartphone. Yeah, thank you. Go ahead.
Okay. Okay. Good.
Well noted for that one. Well noted that one. I will try to explore that other means with that one, Dr. Palay, that uh, be included in kind of in the future study with this. Okay, if I may continue, pertaining to the limited studies examine how integrated of EMS with other healthcare providers can enhance efficiency or address the challenges of implementing collaborative approaches within the diverse and evolving healthcare infrastructures. Furthermore, advanced data analytics and technology show promise for improving EMS efficiency. Practical applications in developing regions are underexplored, and there is a need to understand how these technologies can be adapted to overcome infrastructural barriers. This study addressed these gaps by developing a comprehensive framework for the optimizing ambulance delivery through strategic integrations and collaborations tailored to the UAE, providing insights and recommendations for enhancing EMS efficiency and patients' outcomes in a complex healthcare landscape. Okay. So other than that thing is that due to the geographical locations and mostly, especially in the Al Dhafra region, I might say that there's a lot of uh, empty quarter. We call it the empty quarter in the Western regions. Sometimes people traversing from UAE to Saudi is, using that kind of path or their roads is very crucial. So sometimes they call it, but eventually the problem is how can I locating this kind of, spans in the area. So that's why the use of aerial or the fixed wing, the helicopters is being crucial in that area. And plus the other type of ambulances that being going to be uses for the uh, desert challenges. Okay. For the significance of the study, this study will benefit the following beneficiaries and provide them with the expective or respective advantages. For the UAE government, this study provide the UAE government with insights and recommendations for developing a resilient, patient-centered EMS system that aligns with the country's national healthcare goals and supports the growth for a robust healthcare infrastructures. For the healthcare administrators and policymakers, this study will offer evidence-based strategies and actionable recommendations that will help healthcare administrators and policymakers optimize EMS integration, enabling better coordinations and decision-making in emergency healthcare services. Healthcare providers and hospitals. This study will enable healthcare providers and hospitals to integrate more effectively with EMS, improving patients' transfers, reducing waiting times, ensuring better preparedness for incoming emergency cases. For ambulance service providers, this study will provide ambulance service providers with a comprehensive framework to improve operational efficiency, optimize resources management, and enhance response times, leading to more effective emergency services delivery. Patients and families by improving ambulance response times, coordination, and overall EMS system efficiency. This study will enhance patient outcomes, contributing to better survival rates and a higher quality of care during emergencies. For the academes, this study will contribute to the academic body of knowledge of EMS optimization, particularly regarding the integrations of ambulance services with broader healthcare systems in rapidly developing regions, advancing both theoretical and practical understanding in this field. For the future researchers, this study will serve as a foundation for future research on ambulance delivery optimizations and healthcare system integrations. It will provide a comprehensive framework and identified gaps that future researchers can build upon to further investigate the effectiveness of integrated EMS models and explore new areas of improvement in emergency healthcare systems. Review and related literature. So for the review and related literature, I divided into some kind of topics for EMS and demographic profile and so on. So you may ask if while I'm doing or preparing this kind of presentations. The age distribution respondents plays a significant role in influencing emergency medical services, planning and delivery, as different age groups have distinct healthcare needs and challenges. In many studies, older adults had been identified as more likely to experience complex health conditions, which require specialized medical attentions and longer response times. I will show to you one of the studies that pertaining to the geriatrics more in coming years will be increasing. So most probably of the increase in terms of their needs and healthcare systems will be more increasing due to the point that the life expectancy in UAE are being crucial as well.
Mhm.
Older populations are often more prone to the conditions such as cardiovascular diseases, respiratory problems, and mobility impairments, and all of which demand tailored EMS interventions. For instance, elderly patients may need more time and care during transportations to ensure that their medical needs are addressed properly. In contrast, younger populations typically have fewer chronic health conditions but may experience injuries or acute conditions like trauma from accidents or sudden illnesses. So EMS systems serving younger populations might focus on speed and efficiency in response illnesses. So EMS systems serving younger population might focus on speed and additionally, younger adults may be more receptive to EMS technologies such as app-based services, which can improve the accessibility and the efficiency of care. Thus, understanding the age distribution of respondents in EMS studies helps tailor service delivery to meet the specific needs of different age groups, ultimately improving the effectiveness of emergency medical care. Gender differences in perceptions of ambulance services can provide valuable insights for improving EMS system. Research indicates that men and women may perceive EMS services differently based on factors such as cultural expectations, health needs, and personal experience with the healthcare system. For instance, women are more likely to report higher satisfaction with the perceived emotional support provided by the EMS systems, while men might focus more on the technical or physical aspects of the service, such as response times and efficiency. This gender-based disparity and perception can inform EMS system improvements by ensuring that both emotional and physical aspects of care are adequately addressed. Moreover, gender can influence health conditions that require EMS attentions. Studies show that men are more likely to experience trauma-related emergencies, while women are more likely to require services for conditions such as strokes, heart attacks, or children complications. Understanding these gender differences in healthcare needs allow EMS system to adjust their service delivery models accordingly, ensuring a more responsive and patient-centered approach. Highlight recognizing these differences can help in designing gender-sensitive policies and service delivery models that cater to the unique needs of each gender, thereby improving patient satisfaction and outcomes of EMS. I'd like to cite one of these issues, especially in the Sarja area, wherein once we responded for a case of women or women itself, we are not, if I am going to be one of the clinical practitioners, I cannot immediately uh, or touch, or I need to ask permissions from them. Okay, so it's not an easy as it is. We have to wait for their brother, for their father for approval before we we manage or try to assess the patients. So sometimes it always been in our operational kind of activity that one man and one woman should be in ambulance for that one, that the women can immediately address if the patient is a woman or a girl per se, okay, or female in terms of the gender. So there's always been that kind of ratio of staffing in our company, in our operation, especially in the area where in the suburb areas mostly are in the area of the Emiratis. So we have to always allocate a male and female kind of team for them to immediately address if there is a female patients we have. For the educational attainment of individual plays a significant role in their understanding and engagement with EMS system. People with higher levels of education tend to have a better understanding of healthcare services, including the EMS system operate and the importance of timely medical interventions. So in general, individuals with higher educations are more likely to engage in preventive health measures, recognize medical emergencies, and make informed decisions about when to call for ambulance services. Additionally, educational attainment can influence individuals' attitudes towards healthcare delivery. For example, those with higher level of educations may be more likely to advocate for improvement in EMS systems, including the adoption of technology and evidence-based practices that enhance patient care, according to Liu et al. 2022. On the other hand, individuals with lower educational attainment might not fully understand the role and capabilities of EMS, potentially leading to the misuse service or delays in seeking emergency care, according to them, suggest that targeting educational campaigns aimed at improving the public's understanding of EMS services, particularly in lower income or less educated communities, that can enhance the effectiveness of ambulance delivery systems. This educational intervention can help bridge knowledge gap and foster better utilizations of EMS services, ultimately improving health outcomes. In conclusions, demographic factors such as age, gender, and educational attainment are crucial in shaping individuals' perceptions and interactions with EMS. Tailoring EMS system to consider these factors can improve service delivery, patient outcomes, and overall system efficiency. Optimizing EMS. So the integration of ambulance services with other components of the healthcare system, such as the hospitals and clinics, have shown significant improvements in patient outcomes. According to Liu et al. 2022, emphasizing the importance of seamless coordinations between emergency medical services and healthcare facilities to ensure the patients receive the most appropriate care without unnecessary delays. Effective integration ensures that ambulance teams can quickly transfer patient information to receiving hospitals, enabling medical teams to prepare for the patient's arrival and provide timely treatment. This can be particularly crucial for conditions that require immediate interventions, such as heart attacks, strokes, or severe trauma. Similarly, Syed 2023 notes that the integration of ambulance services with hospital networks helps to optimize resources allocations of EMS by identify the nearest facilities that are best equipped to handle specific emergencies, thereby reducing response and treatment times. In addition to the integration of EMS and healthcare facility collaborative efforts between emergency medical services, local governments and private sector providers also play a crucial role in optimizing ambulance delivery systems. According to Cora Manech in 2020, discuss how collaborations between public and private sectors along with the local government coordination can help ensure the ambulance services are better resourced and more efficiently managed. For instance, an LGU can provide funding, infrastructures, and personnel, while private sector companies may contribute by offering technology and equipment or additional services like air ambulance support. This collaboration can also extend to creating joint training programs for the EMS personnel, improving service consistently across different sectors. So, according to Elbana et al., that argue that the public-private partnership have the potential to improve not only the efficiency of ambulance services, but also their effectiveness in meeting the diverse needs of populations. By pooling resources, expertise, and data, these collaboration can ensure that ambulance services are more responsive and patient-centered, ultimately leading to better health outcomes. Strategic healthcare system integrations, including collaborative efforts between EMS, healthcare providers, and government sectors, foster a more robust and coordinated approach to emergency care. This integration enhances the capacity to respond to emergencies, provided timely care, reduces system inefficiencies, and improve overall patient outcomes. The other one for the primary challenges and limitations of current ambulance delivery systems. Apologize, fellows, because this is a lot of, deep studying. So I was trying to connect everything what in my, my curiosity about this kind of study. The primary challenges and limitations faced by current ambulance delivery system often revolve around resources constraints, geographical barriers, and delayed response times. According to Sirisha Matur and Wachinaradi, 2019, highlights that many emergency medical services systems struggle with limited resources, such as a shortage of ambulance staff and medical equipment. These limitations can exacerbate delays in reaching patients, especially in areas with high demand or limited resources. This can lead to suboptimal patient outcomes, particularly for conditions that require rapid interventions such as cardiac arrest or severe trauma. Similarly, Yan and Mu in 2019 discuss how geographical barriers such as remote or densely populated urban areas can complicate ambulance dispatching and response times. In rural areas, long travel distance and inadequate road infrastructures can significantly delay EMS response, while urban areas may face congestions that impede timely delivery. One of these scenarios I may say is during the pandemic time. There's a scarcity in terms of the PPE and the kind of protocols that we have to address or to adopt, because during that time, the first 6 months of the pandemic is very crucial. We have uh, manpower are one of the problem during that time, because most of our colleagues also is sick. So we have to man 24/7 kind of ambulance systems. The other things that one the the integrations in the hospital settings now, because we don't have enough hospital facilities or infrastructures that are dealing during that time of COVID, especially in the Northern Emirates, because they don't have enough facilities or beds to address this matter. So the limitations within EMS infrastructures also impact the ability to deliver efficient and effective care. Try to imagine you have one patient or two patients inside the ambulances, and you've been running out of oxygen for almost 8 hours already, just only to admit the patients in the hospitals. That is very crucial. Uh, uh, our resources during that time, uh, we shifted our I may say our logistics between the the area of Dubai and Sharjah, to the point that the oxygen scarcity during that time is very crucial. So we have to admit that we need to use some political backup power just only to secure oxygens from other countries during that time. So according to Minister in 2013 points out that inadequate of outdated infrastructure such as communication system, equipment, and dispatching systems can create bottlenecks in service delivery. For instance, insufficient or poorly maintained communication system can result in delays in dispatching ambulances, causing vital time to be lost before paramedics can arrive at the scene. This becomes particularly concerning in emergency situations that require immediate intervention, as delay can lead to worsened health outcomes. According to Hogan, in 2019 also notes that inconsistent training or lack of advanced equipment may prevent EMS personnel from providing optimal care, which can affect the patient's prognosis. Inadequate infrastructures may also include poorly coordinated services between different healthcare facilities, which can lead to the delays in patient handovers or improper treatment at the emergency scene. Moreover, Syed emphasized that delays in ambulance response are often compounded by logistical challenges such as inefficient allocations of resources and inadequate coordination with hospitals and clinics. So these systemic issues not only affect the efficiency of the EMS systems, but also contribute to the uh, poor patient outcomes. The gaps in infrastructures, resources, and coordinations highlights the urgent need for comprehensive improvements in EMS system to ensure timely, effectively, and equitable emergency care. The integrating ambulance services with the primary and secondary healthcare system is a critical strategy for optimizing emergency medical services and improving patient outcomes. Effective integrations involves establishing strong communications channels between the EMS providers, hospital clinics, and other healthcare facilities, ensuring that patients receive continuous care throughout their journey from emergency response to hospital treatment.
Ami,
Yes, doctor.
yes. Pille has just left because he has some hospital emergency appointment, and I would like to ask you some of the questions in between. See, some of the detailed literatures and all you can explain for the second presentation, seminar presentation, because you will be also
Yes,
having
doctor.
the two research seminar presentation. Yeah. So I believe
Yeah.
since you come from a background of ambulance emergency medical services, you can keep this topic itself because you have a lot of idea. You can incorporate it. So my questions, I have written many points, but the things concern, already you have addressed. If my question was, what is the major objective of your study? What is the statement of the problem? Why you reached into the particular situations? So what is the lacking areas? What is the research gap particularly I wanted to ask? But already you mentioned that as well in your PPT. So there is no scope for asking these questions. But now I have some questions that
Yes, doctor.
after some of the things, like literatures, etc., we need to have second presentation at the time you can include in that. So my some of the
Yes,
questions
doctor.
are, I have noted down here. Just wait. So talking about, you have talked about its importance, relevance, and uniqueness and everything you mentioned here. So what type of, you didn't reach there, you can do the next presentation, but my question is also
Yes,
related to
doctor.
that research methodology. I know that you didn't discuss that yet, but sometime the
Mhm.
time may be constrained today to discuss all these things, but I wanted to get some idea. What is your research methodology? Which type of
It-
methodology you're following? Like, and one more thing I wanted to ask you, uh, data collection method particularly. Are you following the survey method, interview, observation, or do you have any particular type of people as a respondents? Okay, are you
in
going with,
terms
yeah, are you going with the paramedics or hospital administration, patients? Who is your stakeholders to collect the data for?
in terms with the methodology, doctor, I'll be using the mixed method methodology for these things, both
Mixed
quanti and
method.
quali.
Okay.
Yes, doctors. So
So
in
I
terms
want to
with the
know who is your respondents?
respondents for these things, doctors, first one are the decision makers in the hospital administrations mostly.
Okay. Okay.
Okay. Then same with the people in the ambulance, mostly in the operations and the decisions makers,
Very good.
supervisors for these things.
So do you have
And
any respondents in terms of patients?
yes, doctor, especially the one who are paying for their bills,
Okay.
because that is one of the crucial things that uh, mostly, if I may try to consider the insurance policy makers, insurance, then the government policy makers and in Department of Health and Ministry of Health to get their point of view pertaining this kind, because they are the one of at the end of the day they are the one being using this kind of study, and I think they're much more involved on their kind of part as they are one of the regulatory bodies. They are the
Okay.
governments.
So perfect. So my question is, what challenges particularly do you, oversee in your data collection? Is there anything related to ethical issues or compliances or something?
That challenges first the availability of the person who's going to be the point persons that are going to be, the will be the one addressing this kind of questions, especially in terms of the question and answer portions, in terms of their expertise. In terms of ethical, there is no such thing as gonna be dealing in terms of ethical, and there is no gonna be confidentiality to be breached to the point that the patients are not gonna be involved in terms of their uh, previous scenarios or scenes that they have, but their point of view in terms of what kind of feedbacks that they can provide in terms of the ambulance to the hospital kind of uh,
Okay.
gap during that time that they've been attended to by the ambulance personnels or the pre-hospital providers during that time is very crucial as well.
Okay. So, can I conclude with my questions? That is, how could your findings? Obviously, you will be having some findings. I need only 2, 3 lines, an answer from your side, specific answer. How these findings influence the policy or decision making within, healthcare sector, particularly healthcare institutions. It can be paramedicals or anything, it can be included. So how you feel that your work is going to create a outcome to this policy making and financial decision, decision making of this concerned authorities?
Uh, One thing in the side of the pre-hospital providers or us EMTs paramedics, there will be more on specific things on the clinical guidelines approach that the hospital facilities that we are, because that is the end point of our patients, is
Yeah.
will be built
Mm-hmm.
optimally
Mm-hmm.
to lessen the times, immediately address that the issues pertaining from what we gathered informations during our management once we address the patients immediately. So from the personal informations, that data collections going immediately to the assessment process, if the healthcare facility or the hospital facility have that kind of capability to integrate in terms of these kind of practices, it will lessen not only the time but increase the prognosis or the optimal care of the patients or address the concerns of the patients immediately in terms of the medical and trauma
Okay.
emergencies.
Very good.
Yes,
So,
doctor.
your research is talking about the healthcare system, at the same time, emergency medical system, and you're also looking for some of the logistical side. And your research methodology, research questions and objectives are crystal clear, which gives a good message to us, like, okay, you wanted to cover all these areas. So let me recommend you something more. Yeah, not a recommendation, just I wanted to know what are the limitations of your study particularly.
But the limitations of the study in terms of the um, hold on, because it is in my presentation as well.
Yes.
Hey, doctor,
Yeah, no problem.
my slide is not working properly. Sorry.
You're going up. Okay. This one, yes. Next presentation, Ami. For the
Yes,
next time,
doctor.
next week, we will be also having your presentation. You can continue this, the remaining
Yes,
area.
doctor. Okay,
Okay.
doctor, because I
I
think I
believe that is
already
good
dis.
because I could see the predictive analysis and big data. Some of the studies, the content analysis also you have added into that. So this will give a more insights to others researchers as well. Because your way of presentation is good in terms of including the major content into that, It is directly connected to topic. So it will be also good for others to join and others to get more information from this. So limitation will be, as far as I'm concerned, mainly the data collection will be one of the major limitation. The second one is your point of contact, the people who are in the decision making is somewhat very high authoritative people. So sharing the information will be some sort of difficult task. But patients
Yeah.
who are coming to the hospital, they are coming for a certain task and certain diagnosis. During the time, getting information somewhat is difficult. So the fifth one, yeah, yes, the ambulance service people, yeah, that you have a presently contact that maybe you will be getting the access to them mostly. So other things are, this topic is already some of the positive advantages what I have understood. Number of studies already done in this particular topic. Number of studies in the sense like emergency medical service, particularly in UAE, I could not find any topic medical services, but you can also find it out. But relate to that study, you can also getting a number of access to the materials. That is a very good advantage of that I'm seeing for your topic. The second one,
Yes, doctor.
presently you are working in this field, you are having the connection with the many people. That is another advantage. Already you are having an idea, that's also will be enhancing something more into that. Yes,
It is,
I
doctor.
yeah. I wanted to conclude the session within 5 minutes by after the Bala's question. Bala, do you want to add any questions?
Yeah, I have only one question. Thank you for the wonderful presentation, Dr. Amit. Um, is there any software available for integrating such services so that people or the patients they get those who are in the needy persons can get the services on time.
Uh, thank you for the questions, Dr. Bala. Actually, the only software that we are having is the 998 applications in the Northern Emirates. I'm not too sure for that one here in Abu Dhabi if they have, but and for the people in northern, especially in Sharjah going to Fujairah, this is the applications that they're using it to activate the ambulance service. But in terms of the integrations from patients to the hospital thing, and that is the other thing that we're missing around. In Abu Dhabi, we have the TAM and we have the SEHA applications. In the SEHA application, you can only just to book your appointment for such particular but you are the one going to their facility, not the ambulance will be bringing you to the facility. Okay, so that's just the one thing of difference, especially with the hospitals have their own ambulances services like the Mediclinic. Mediclinic have their own kind of ambulance services. Same with the Virgil, they have their RPM ambulance services that can cater from their own facilities, from Berger to Al Ahlia hospitals and their networks of their hospitals. Same with the Mediclinic. But they are not the one responding in the public. I mean, responding going to the house or for any kind of emergencies on the roads, they are not the one responding. So they have different kind of only scope of their ambulance services. I
No,
hope I answer your questions properly.
thank you, Dr. Amit.
Thank you very much, Dr. Pilay.
Thank you, thank you, Doctor.
Anything else, Doctor? We cannot hear you, Doctor. We cannot hear you.
Okay. So what I would like to conclude, Ami, your topic is very crystal clear, nothing more to think on it. Continue the same topic. And the recommendations are for the next week, we will be also having more number of people to joining. So you have to address their concern as well. Like that we can also ask them to ask the questions related to your topic. And
Yes,
yes, this is all about, just include a next presentation. You can also add some of your limitations and some of your advantages of doing, being a person, being a person who comes from this field. What's the benefit that you're getting? Sometimes maybe your self-actualization, it's supporting for that. So something related to
I
that
will.
also you can add it. So this is all about.
Yes.
Thank you. Thank you so much, everyone.
Thank you, Ben.
Have a
Thank you very
wonderful
much,
day.
everyone.
Yeah.
Thank you, Doctor.
Have a good day,
Bye.
everyone.
Yeah.
Thank
Thank
you.
you.
Thank
Bye-bye.
you. Bye-bye.